I'm Dr. Wesley Shankland. I practice in Westerville, which is a suburb of Columbus, Ohio. And my practice is primarily dedicated to oral facial pain, TMD, and sleep. And I've done that since 1983. But today I'm going to just show you a real brief video of how we can maybe help people control intense clenching by using some Dysport. Now, Botox or Dysport can be used, but I prefer Dysport at this time. And Dysport reportedly has a quicker onset and longer lasting, a little bit longer lasting than Botox. I can't prove that, but that's what I've read. But be that as it may, we're going to use some Dysport here, a little botulinum toxin here, to decrease Rachel's intense clenching. Now, fortunately, this lovely lady is not only a dear friend, but she's my hygienist. But Rachel is a real clencher. And tell me, do you clench a lot?
Absolutely.
Do you do it at night and day?
And day. I'll catch myself during the day all the time.
I want to show people, we're going to primarily treat the masseter muscle. That's this muscle right here. And I tell people the masseter is like the biceps of the jaw. Now, turn your head my way. Now, if you can see this, what I want you to do is clench your teeth. I hope you can see that right here. Do it again, relax. Now clench tightly. Can you see that pop out a little bit? That's her masseter muscle. And this is causing her to clench her teeth and causes sensitive teeth. It can cause headaches and cause facial pain. We already have her wearing an NTI appliance now, but she needs something to even decrease the clenching more. So we're going to use some Dysport here, and it works very well, very quickly. And she'll see effects probably in 2 or 3 days here. So the first thing I'm going to do is clean this off a little bit. We're going to use about 30 units here. And 30 units are delivered quickly and nicely with no trouble. And I'll show you here. Now, can you come over this way? Can you see it okay this way? Clench your teeth. I see a bulge again, relax. Clench, bulge. Then you hold it like that, okay?
Mm-hmm.
You okay?
Mm-hmm.
There. That's how quick you can treat these folks with Dysport. Now, did that hurt you very much, to be honest?
No.
Yeah.
Pressure.
Pressure. And we use a very small insulin type of a needle. Now, if we do a lot of Botox or a lot of Dysport on people to decrease, like, now she doesn't need that, but if we had wrinkles here or what people commonly call crow's feet here, or if I wanted to use something in the nasolabial fold here, then I'd use a local anesthetic inside her mouth to numb her up. But these other areas here, we can actually put a topical anesthetic on her face, let it sit for about 15 minutes. And when you do that, she won't feel anything, because these are uncomfortable a little bit. Not bad, but uncomfortable a little bit. I've had this myself, so I know what I'm talking about. So we use a topical anesthetic on a lot of people if we're going to do the whole face. A lot of times, too, for the headaches, I'm doing this today primarily, turn that way, just look. Clench for me. Good. Primarily just for her clenching and not for headache pain. If we're going to do headaches, what we would do is we'd probably do the masseter muscle. We'd use the temporalis muscle here, areas of the glabella here, the corrugator, and in this area right here. And we'd would go back here perhaps in the occipital portion of her head. And for really bad folks, we can actually even give some of this Dysport and the trapezius muscle here. But for today, this is only for our clenching. So I'm going to show you again. It's real quick. It's really sweet. Now, Rachel, clench again, dear. Now, see how she is right there. And that's it. Lord, if I can do that, you can do that. So Dysport is used very nicely. Now, again, was that uncomfortable at all?
No, just the pressure.
Yeah, and she'll notice in a couple of days that her muscles will not be able to bulge so much. She won't be able to clench her teeth so hard. She'll have no trouble chewing. She'll have no trouble talking or speaking. It's just she won't be able to clench her muscles so tightly. And the theory, of course, is so she won't clench so tightly, especially at nighttime. She won't beat up the NTI so much, and she won't clench her teeth so hard, thus reducing her muscle tension, reducing the headache pain as it develops here. So I urge you to try to use some Dysport. Contact your Dysport representative and see what you can do. They're very nice people. They'll help you a lot. And this is a great way to teach this. It's a great way to treat this. Great way to treat this problem. Thank you for watching.